We do have a guest on with us right now, Harlan Johnson. He's going to give some public comment. So it looks like it is 2:00. So I'm going to go ahead and call the meeting to order. And I'll begin with the roll call. Dick Kunert.
Present.
Okay. Present. Hi, Dick. Dr. Copeland. Dr. Gorski.
Here.
Dr. Giardini.
Here.
Tim Neighbors.
Here.
Linda Sandquist.
Here.
Our advisory members, Wendy Larson Bennett.
Present.
Oh, you did make it. You didn't go to jury duty.
No, I got released. Yay.
Okay. And Jay Ware.
I'm here.
Okay, great. For those of you that didn't receive my greeting, I want to wish you all a very happy new year and a healthy new year for everyone. So
Thank you.
we do have Harlan Johnson for public comment, and that is next on the agenda. And obviously, Harlan, you know that it's a 3-minute and we don't respond at the time we listen, and appreciate that you're joining us with the public comment. So
I'm ready, and I'll be watching you on YouTube in case you do decide you want me to come in.
Okay,
Ready?
we're ready.
Well, I'm Harlan Johnson. I'm a licensed marriage and family therapist and a licensed clinical professional counselor. One of my specialties is trauma, including post-traumatic stress. I observed the mental health board meetings. For years, I attended the Winnebago County Mental Health Committee's meetings as an observer, doing all I could do to support efforts to finally have a mental health board. I'm delighted the mental health board is functioning so well. On March 8, 2018, when Raul Almazar from the National Association of State Mental Health Program Directors Center for Innovations in Trauma-Informed Approaches met with about 150 of us, I joined the Trauma Informed Community Initiative. Since we began, many positive things have been done to increase implementation of a trauma-informed awareness in our region. My concern is that a crucial resource is not involved with the trauma-informed initiative. Hundreds of behavioral health professionals. Few of them are in touch with each other or with you and your work. So I'm requesting that the Mental Health Board contact the Illinois Department of Financial and Professional Regulation and request that they give your board the contact information, phone numbers, and emails of all behavioral professionals in our region so that you can inform them and help them to connect with the board, local agencies, and each other across professional barriers to unite and increase trauma-informed awareness and resources. I'm referring to pastoral counselors, clergy, licensed clinical professional counselors, licensed marriage and family therapists, social workers, school counselors, psychologists, psychiatrists, addiction specialists, probation and parole officers, and others. Many of these people are out of the loop and aren't aware of our initiative. Few use the ACEs instrument, which I love. It's crucial in their work. Many aren't aware of the book, What Happened to You? Conversations on Trauma, Resilience, and Healing by Bruce Perry and Oprah Winfrey, or the initiatives of the Harlem School District to respond to the needs of traumatized children. Some wonderful things are being done, mostly by volunteers like me, thanks to the facilitation by the Winnebago County Health Department. And yet there are significant gaps. By connecting with all of the behavioral health professionals and helping us, all of us, both individual practitioners like me, those in groups and agencies, to be in touch with each other and with you, we can add hundreds of trained professionals to this initiative. Thank you.
Thank you, Harlan. We appreciate that input.
Yes, thank you. Thank you.
Okay, moving on. Jason, are there any presentations that are going to be completed today or presented today, I should say?
There are no presentations scheduled for today.
Okay. And the next agenda item is a monthly activity report, which is in our packet, but do you want to highlight some of this, Jason?
Sure, yeah. The major thing I'd like to highlight, and I think what's been consuming a good deal of our time over the excuse me, the past couple months is really working with each of the agencies to get all of their financial reporting in place and in compliance with the mental health board's policies and the funding agreements so that they can get reimbursed for their expenses. And so to date, we now have 35 payment requests that have gone through the process and have been approved and have been submitted to the county health department as a fiscal agent to issue payments. And so that process is working very well. Checks have gone out. Programs are getting paid and reimbursed for their expenses. We worked through with most of them any issues that there were with producing the proper evidence or appropriate evidence and getting their budgets in order. We also have been working very closely with both the health department and also the county finance department to prepare for an audit, which we believe is happening in January, which will audit our first 4 months of program year, which started in June. So June, July, August, September, which would have fallen into the last fiscal year. So we'll get some good rapid feedback on our process and anything that we can improve there. But we have, as far as the conversation has been so far with both the health department and the county finance department, that it looks like our process is working well and should be prepared and ready for audit.
And I just want to commend you and your staff for, I know this has been a tedious and time-consuming exercise and so much oversight on your part, especially this beginning stages of getting everything to conform to what the county needs and what, all of the funded agencies need. So thank you very much for this. And I'm sure that, this is going to help us going forward, that this foundation is what we had to establish. So thanks.
Thank you, Marianne.
Okay, we have 3 action items. The first one being the minute meetings from the December 2021 meeting. So I do need a motion for approval.
So moved.
Do I have a second?
Second.
Okay, is there any discussion at this point, corrections, additions, or hearing none? I will go ahead and take roll call. Dick Kunert?
Yes.
I didn't hear you, Dick.
Yeah, yes.
Okay. Dr. Copeland? Dr. Gorski?
Yes.
Dr. Giardini?
Yes.
Tim Neighbors?
Yes.
And Linda Sandquist?
Yes.
And Mariana Body, yes. Okay, and the second action item is the FY 21-22 funded program budget amendment. And Jason, do you want to explain?
Yes, so the sheriff's office put their mental health services out for RFP. That was something that was approved by the mental health board as part of their work plan and their original proposal. So they did contract for those services. The services came in a little bit under budget per the proposal that they received. And so the sheriff's office has requested to do 2 things. One is they had separate line items in their contractual services in their original budget, and everything now is basically being received by them in one invoice from the provider that they're contracting with. So they're wanting to first consolidate all of those line items into one for the contractual. And then secondly, they're looking to move $55,000 from that line item to mental health administrator line item, wherein they would actually hire themselves a coordinator position who would help administer the program and producing the performance reports, working with the financials, but also do more outreach functions and connect with other organizations so that appropriate referrals and handoffs can be made, especially for those being discharged from the jail. And so that position is being proposed to be hired by the sheriff's office and to be under the supervision of Sergeant Pont, who is the grant contact and who has been working very closely with us on this project to date. Also, I'll note in your packet, you should have received some information on the Stepping Up Initiative, which is a national initiative aimed at reducing the number of people with mental illnesses in jail. And so the sheriff's office, as my understanding, is participating in this initiative and would like the coordinator to also be the lead person who's involved in this initiative and ensuring, kind of, I guess, understanding the best practices of what other communities are doing and trying to really push forward Winnebago County as a leader in the country as it relates to mental health treatment in the jail.
And just to add to Jason's report on this amendment, we did push back to get more specifics on the coordinator that they were talking about to ensure that it made sense. And do you want to comment on that? Because they
Sure. In the packet itself, you'll see the follow-up questions that I had for Sergeant Pont. Number one was if it was being an employee of the sheriff's office, whose supervision the position would be under, and then also what the position qualifications would be, and a brief synopsis of the Stepping Up Initiative. And then you'll see the response that we received, most of which I already commented on.
right.
And then the qualifications for the position, who it would report to, and then also the packet that was accompanied that gave more information about the Stepping Up Initiative. If this is approved, it will then accompany also a work plan amendment, which does not require full board vote, but based on the budget approval, we would then do a work plan amendment to add this position into the work plan. And Mary Ann would be the one to sign that. We have discussed that should this be approved, that we may also take a look at the outcomes that are associated with this position and add any additional outcomes that should be appropriate for the scope of work to the work plan.
So, I mean, in
Question.
summary, go ahead, Dick.
Yeah, a couple questions. First of all, so part of the job description that you just told us about sounds almost like a case manager. How is it going, the linkage between the people in jail and also what we're funding with the medical school or with the clinic? Since they were supposed to be doing a warm handoff for people coming out of the jail, is there a connection between these two? That's one question. And then the second one is the Stepping Up program. I mean, it seems like conceptually it wants to do at a federal level exactly what we all sort of have hoped for that we were going to be creating locally. And at one point, I think Sergeant talks about technical support. Now, do they actually have a grant from the Stepping Up? Have they gone that far? Or what is their true relationship with Stepping Up? Or is it just simply the borrowing from the concept?
Dick, I'm sorry to say I don't know the answer to the specifics of their current participation in the Stepping Up Initiative in terms of if they're receiving actual technical assistance. That's a follow-up question that I could certainly ask for. As it relates to your first comment about this being case management, I think what would be different is that this person is, as I understand it, would not be intended to actually work directly with clients, but it would be more about making connections with other organizations themselves, and then having the current mental health staff who is working with clients in the jail to be aware of those resources. So when they're doing discharge planning, that they're making the appropriate connections. Now, in terms of what the medical school provides, that is still in place. And I believe that the sheriff's office is considering that one of the referral sources, but has not made that the only referral source. And so, that the warm handoff idea, it's still available there. But because the UIC themselves is not the provider that's providing the service in jail, it's not fully connected at this time. Also keep in mind that the behavioral health staff for the jail, they're under contract. They just started January. So that was the RFP process that the jail went through, created a delay where their staff is just now coming on board. I've actually been invited by the sheriff's office and Sergeant Pont to meet with that staff team next week as they're coming on board to discuss with them and really get to know them, but also understand their vision for the program.
And can I add, so when I first got involved with the mental health tax, one of the people I talked to was Kathy Zenoff, the Associate Justice. And she immediately referred me to the Stepping Up program, which isn't in play in Winnebago County. But if you look at the materials Scott Block has been sending us from AOIC, they are trying, I think, on a state level to bring the Stepping Up. If you look up Stepping Up in Illinois, you'll see they're trying hard to connect what's going on in the mental health system, the court system, the jail system, and get sort of a smoother process. And I think we're in the throes of that. And there are potential resources out there for the county through the Stepping Up initiative, as well as like some of the ACME stuff. There are a lot of people who suddenly are recognizing that what we're doing with the jail and the mental health community is an important stepping stone. And I think we're going to end up being sort of the thread that ties these things together long term.
My memory serves me correctly, I believe that Winnebago County or the Sheriff's Department or whoever could have applied for this grant from Stepping Up, we chose not to do that in Winnebago County. So
that could be.
Yeah, I mean, I'm almost positive about that, but I mean, I'd have to verify that for sure. But I think what's happened is the influence of that Stepping Up program through Justice Zenoff and others has, certainly been the model for what, obviously now the jail is even trying to get someone to be a liaison, a coordinator in a sense, to ensure, that parts of this program are implemented. So I don't think we have the grant here.
I don't think we do either. But if you look at the material Scott Block has been sending us, the Illinois Mental Health Task Force does talk about
all the
up.
time. Yeah.
Yeah. So, and we're, so they're coming at it from the court system. We're coming at it more a community-based resource. At some point, we're going to have to hold hands and figure out how to bridge whatever gaps we all perceive. So.
And I apologize for this question because I suspect I've missed this somewhere, Jason, but in your second point in your email back to Sergeant Pond about the position qualifications, did I miss that? I don't see that articulated in his response. Maybe it's there and I've just missed it. We did find out what the position qualifications are.
Now that you're mentioning it, Dr. Gorski, I don't think that was outlined in this. So that would, I think, be another follow-up for this
Because you mentioned that it's needed for a work plan amendment.
Yeah, it would be required for the work plan amendment. So
I also think it'd be interesting to know what type of training they're looking for with this type of individual. Just a point of interest even.
Yeah, okay. And so to clarify on the Stepping Up, It's my understanding that they're not currently participating in that, but that is part of the future plan to have a coordinated effort where the courts and everyone would be on the same page in the collaborative participation of that. So
We, at this point, we're going to ask for a motion to approve this amendment, but do you think that we should hold off until we get questions answered? And then come back with the qualifications and also, just, I don't know, Dick, your question was probably answered now with what Jason just found out, but
You can always table as well. That's another option.
table it.
That's an option.
Okay.
well, I might suggest that if we're going to push it, that we maybe invite Sergeant Pont to come to our next board meeting so that he can answer these questions directly.
I think that would be
or
helpful.
Somebody from the sheriff's office to
Really
come
good.
so that we don't have another iteration of
Right.
new questions coming up that I didn't ask, and then we have uncertainties.
Great idea. Very
It's going to
interesting.
be, this is going to be one of those programs that we're going to hear year in and year out. okay?
Right.
Go away. So the more we know about it and how people fit together and how the pieces fit together, we can do a better job of our task of making sure that, we're not making double payments and we're not buying something that we don't want. So, I think having Font come to and talk to us about it is a really good idea. Let's move that we table this, request from the Sheriff's Department until we get more information.
Does that require a vote? Yes.
Okay, I'll
it does.
second.
Okay, that's fine, then I'll go ahead. So Dick has made a motion to table this funded program amendment, budget amendment, and until the February meeting. I will need a second for that.
Second.
Dr. Gorski, thank you. Any further discussion? Hearing none, I'll take roll call. Dick Kunert,
Aye.
Dr. Copeland, Dr. Gorski,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist. Aye. Mariana Body, aye. So that will be tabled.
Jason, could you also I'd like to know more about how they're going to coordinate with U of I so that we're not stepping on each other, or they're at least aware
I
of.
will ask them to speak to that point when they come to the February meeting.
I think that's helpful. Okay, the third and final action item is the new board member appointment recommendations. And just to give you some context to this, Jason can speak further on it, but I did receive a call from the chairman's office, and there are two potential board members, well, I should say one potential board member that has to be approved by the county board. And at this point, obviously, Wendy Larson was contacted, and that was one of our recommendations. And then the other recommendation for advisory was Jeanette Towns, and that was also one the chairman is putting forward to the board, but nothing is final there yet unless the total board approves it. So now that we have another board, but it looks very positive. And then we have another board position open with Danielle's, I don't want to call it retirement, but she resigned for good reason. And so we have that open. And Jason, maybe you can just let them know the communication with the chairman's office and Tim. I know you talked to him, so you can inform the board.
Tim, do you want to take that?
You can. I'll just do a follow-up.
Okay. Well, yeah, I didn't speak directly to the chairman's office on that point, but Did talk to Tim a little bit about the process, and Dick and Marianne, of course. So I don't have any really additional information about the process other than what we originally did. You know, if you would like to do an application process again, with the click of a button, we can reopen that. We still have from the original, I think it was, Chelsea, was it 15 applications that we received the first time? I think there's a couple of those that are probably automatic disqualifications on the basis of people who are now applying for funding, or parts of organizations that are applying for funding. And with the recommendations that were made, it definitely leaves the pool a little bit smaller for who is left out of that application packet. But certainly open to provide support to the board for whatever you determine you would like to do regarding this.
And Tim, do you have more to add to this?
No, that's basically it. It's just, you know, the process, Wendy's already been brought to the board for approval of being a member of the board. It just has to, excuse me, sit on the agenda for 30 days, then get approved again for finalized. So our next board meeting, it should come up next week. The next one, when I talked to the chairman, he was wanting to know, well, if we wanted to just select someone out of the applications that were already presented. And I think he's looking to do something like that.
Okay, so he's open to the mental health board, again, giving recommendation, whether or not he accepts that's, you know, up to the chairman and then the board. So what at this point, the discussion is that there's been, as Jason pointed out, the process of elimination of a couple candidates. Primarily they're with organizations that are funding or are potentially going to be asking for funding this cycle. So if anyone has a recommendation at this point that they'd like to discuss with the board, this would be the time to talk. Bill,
You've
go
got a
ahead.
question, Marianne.
Yeah, maybe it's more of a question. Is there any thought behind pivoting the recommendation around Jeanette from advisor to a board member?
We talked about that. We just wanted to let the process go with Wendy with this current board position, because we almost just moved her up to Jeanette. So we just said we'll wait and see how it goes and cross the bridge when, because I think we discussed it before Danielle actually she was just talking about putting her resignation in.
Okay.
And she hadn't put it in yet. But after the spot came open, we just said we'll just take the recommendation from the board.
Okay, makes sense.
Okay, Dick, you had a question?
No, I was just commenting on Bill Gorski had a question. So we're going to take a look at people who are currently on the list.
Yeah, I mean, the packet was, you know,
Okay.
there to look at all the applicants, and yeah. So if you felt strongly about one that, and actually,
My experience is with Muhammad Yunus, who was that singer with me. I hired him first of all as the chief financial officer, and then later, in the way that things came out, he ended up as the chief administrator for Singer. He's had experience. He's been on several commissions with SAMHSA. So this is a guy who has, you know, been involved in program development at the federal level. He also has been teaching at the University of Phoenix for almost 20 years now. So he's a very sharp individual. So with experience in our field, okay? So for what it's worth.
well, it's worth a lot coming from you and that endorsement. What my question, Jason, how did it end up in terms of, because we did take a board vote on how we weighed in, we scored with the rubric, these candidates.
Yeah, so what we did last time was everybody picked from the scoring, picked their top three, and then Jeanette and Wendy were equally rated as the top picks. And then there were, I believe, 2 tier 2 candidates, and then 1 or 2 tier 3 candidates. And I know Mohammed was among those picks. And I know a couple of the candidates that were remaining would have potential conflicts at this point. So I do believe that he was among that kind of those that were selected as a top pick. But I would have to go back and go through those to determine specifically if there are any other that remain without conflicts.
So at this point, I guess the question remains, are we ready to make a recommendation, or is this something that we also want to table for next month and everyone do their homework again and looking at?
Yeah, it would seem
Jason?
valuable to see the scoring rubric again and
I
and look
agree.
at it one more time. I certainly remember some, but not enough to make a judgment at this point. I guess my only, and I don't know, as Dick does know this gentleman, and we hold that recommendation in very high esteem. I certainly do. You know, when I met with Jason, my only thought about Jeanette was that she's a participant in the system as an individual, which I think would add a lot of context. But, you know, be that as it may, it just strikes me as a little bit odd if the recommendation came forward for Wendy and then Jeanette, based on there was only one opening. Now there's a second opening, but she wouldn't necessarily be, maybe she wouldn't be, but it would seem logical that she would become the next recommended member. Doesn't have to be, but that's where my question came from. And it comes from a lack of knowledge about knowing deeply about all of the candidates.
So at this point, the only thing we do know is that what will be voted on at the board level for the Winnebago County Board is one position. So we do have time is the good news. As long as this took to get Wendy approved, then we do have time. And if we want to wait until February, I'm not opposed to that. I don't know how other board members feel, but.
Jason, why don't you resend the materials, and then everyone can review them. And if there's some need for like an emergency meeting or something to make a recommendation. I don't know that there's that need, but.
The only
Yeah.
other thing is that, Tim, when my question is, when the board votes on the board position, do they not vote on the advisory member position too? Or is it just how does that advisory person get appointed?
He should be voted in too. Also, I wasn't at the meeting when Wendy was put on the table, so I didn't see how it was on, but they should vote that too. But just because it's an advisory, I don't know. I know when the original board was voted on, it might just be appointed, but when the original board was put together, the advisory members were on there. So I don't know.
That's what I recall. So
Yeah.
I was questioning that. So it could have been that Jeanette's name was also on there.
Yeah.
Jeanette's name was on the board meeting agenda.
Good.
On the Jeanette's name is on, I should say, yeah, on the
Well, that's
meeting
what
agenda
I,
as
I
well.
just wanted to make sure of. So, I mean, the good news is that assuming everything goes as planned, we'll have Jeanette and we'll have Wendy to at least participate in the next meeting, you know, in their new positions. So we can revisit this in February or a special meeting. What do
So
you
for
recommend, Jason? Do you recommend?
Well, I don't have a recommendation on this particular point because it really, I think, is so much of a board decision. And so I think I'll refrain from making a recommendation on this one, but based on conversation would offer to send out the board meeting packet and the scoring rubric and to
Good.
certainly facilitate the collection of responses from the board members and present that back to you either at a special meeting, should that be needed, or the February meeting in terms of what the top selections were. And, you know, if everybody wants to send me their top choice or a number of, you know, 1 or 2 top choices, and I can just present that back to the board as to what that looks like.
Okay. I think that's very fair. Will this require a motion then to table this either to a special meeting or the next board meeting? Since it was an action item?
I'll make a motion that we table it.
Okay.
Pending board members getting additional information regarding candidates for an open position on the board.
Okay, and do I have a second? Yeah, Tim, do you have a question?
I was second it.
Thank you. Okay, we have a first and a second to table this particular action item. And do we have any further discussion or questions? Hearing none, I'll take roll call. Dick Kunert?
Yes.
Dick, I can't hear you.
Yeah,
Thank you. Dr. Copeland, Dr. Gorski,
Aye.
okay. Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sandquist,
Yes.
Mariana Body, yes. Okay, moving into the discussion items, board reviewers for the 22-23 grant reviews. Jason, do you want to just take that away?
Sure. So I do anticipate we'll receive more more applications this year than we did last year. You know, we only had 18 last year, and based on the number of new applications that have already been filed, if assuming all of the renewal applications file, and just based on people who showed up to question and answer sessions and the convening organizations for collaboration, I am expecting more applications. I don't know that it will be like, you know, exponentially more, but maybe just more. And so our funding policy does dictate that a quorum of board members score each application. So right now we have 7. That would mean 4 people scoring each application. If Wendy's appointment happens before the scoring process, then we have 8 board members, which makes our quorum 5. And if we only have 5 reviewers, as we did last year, then that kind of puts the burden on each person to review and score every application. Certainly, if more would be willing to participate, then that allows for each board member to score less applications and not the full number. So I'm just simply looking for those who are interested to either express your interest today or in advance of the February board meeting. The application closes January 31st. At the February board meeting, we will have on the board agenda a very detailed process, including timelines and for this entire review process this year. We'll wait to see the total number of applications we have before rolling that out, because then that will help us better understand how many scores each person needs to do and the appropriate amount of time that should be allotted for that. So If you need to think about it, great, let me know. If you know today, you want to let me know right now that you would be willing to score applications. I don't know if anybody who scored last year maybe wants to speak to what that entailed. I will say that Kristen did a wonderful job this year of, based on our learning from last year, simplifying the grant application as a whole and taking out some of the things that were either redundant or not necessary to our decision making or the development of work plans. And we also tried to better align the scoring rubric with the sections of the grant so that as a reviewer, you're not having to kind of like go all over the place to try to find the appropriate information. So I do anticipate and hopeful that it will be slightly easier this year, but that doesn't mean it still won't involve some time.
That's great to hear.
And it would mostly be during the month of February also that we'd anticipate, you know, depending on the number of applications we see, we can try to make a realistic goal if they can all be done in 1 month or if they need to go into March a little bit. But that would be, last year we were able to get them all done in 1 month.
Yeah.
I have a question, Marianne.
Oh, sure, Dick. Or, I'm sorry, Bill.
Sure. So Jason, hypothetically, so this is just, I don't want to get in trouble with any board member. So let's say hypothetically, we all agreed to be part of the process. Are you suggesting, and you could take a number and multiply it by whatever, there's 8 board members at that point, would you then divide up the application? So you wouldn't have every single board member review every single application. You would have a group of 4 or 5 or 6, and give them to a couple of board members. Are you thinking of it that way?
Yes, that's correct. And so that way, you know, again, I don't have the math in my head done right now either, but maybe if there's 40 applications and everybody scores, maybe everybody only has to review, well, I'm going to throw out a number that's going to scare everyone, 30, but you know, maybe if there's less, there's 30 applications and everybody scores, maybe then each person only has to do 20 rather than 5 people doing all 30 of them.
Mhm.
Of course, we as staff will also do our due diligence in providing background research on ensuring that the best practices that are referenced are accurate, compiling a kind of some scenario planning for what it would look like if we funded, you know, these 9, but not these 5. What does that put us at for our total budget? What does it look like in terms of the percentage of funding that's going to each priority? What does it look like as the percentage of funding to each target population? We'll provide that type of technical support. And then also based on the board comments that are associated with the scores, do follow-ups with board members, or as we did last year, we had a few sessions where 2 board members would come in together and we'd kind of go through a handful of applications and talk through the comments and any concerns and start to develop what those special conditions are for programs that are going to be funded, but maybe need a few things changed. And this year we might also find that we need to fund some things partially as we did last year that will require some budget amendments to be made.
Great.
Well, I'm going to volunteer to be a reviewer.
I
good,
will
Dick.
too.
I'll tell you what, doing it last year and reading those things, it's like watching, or reading or watching paint dry. They are interesting. I'm not going to lie to you. They are very interesting. They can be really long. And I think you get better insight into where the money is going when you do see that. I personally will do it again. I actually enjoyed it. I'm sadistic that way, but I actually enjoyed reading these things. Some of them do take a long time, but again, it gives you insight into the programs that are out there and gives you better understanding of who's actually asking for the money. And it just provides for you, you know, that understanding. This is a good thing. And then of course you read things, you're like, some of them are like, wow, these people are out in left field somewhere. But then again, you know, I could be as wrong as Rain on a Parade, but they are really interesting to read. They really are. And I would encourage. Okay, laugh. Go ahead.
No, you're right.
No,
on
it's
the
just,
parade.
Well, he inspired me. I'm gonna volunteer. He
Okay.
inspired.
There you go.
Your figures of speech are great, Terry. No, we're not. Well, I think I'll volunteer too, Jason. I'm a little concerned because I'll be gone for a little bit in February, but I'm sort of hanging my hat on your description of the leaning down of the process of the application into the appropriate categories that make the scoring perhaps a bit easier. So I'm gonna hang my hat on that's gonna be make this process more smooth than the way Terry describes it.
Oh, that's a way.
Oh, of course. Hey,
You can just read while you're laying on the beach, Bill.
Yeah.
And keep in
Yeah,
mind,
well,
Not quite so easy.
I don't
Not
know about
quite
that,
so
Wendy. Yeah, especially if it's windy.
Yeah, no
Yeah.
Oh,
kidding.
wait, I got an iPad. That doesn't work.
I was gonna say, just bring your computer. If I'm on the board, I'm happy to participate.
like I said, guys, I really think we should all read them. We'll get better insight into what people are really asking for and how they really want to use it. It's one
But
thing to get
it's
that.
more than just reading them. We need the scoring to go with.
Oh,
So
yeah, absolutely.
that's where the time consuming part comes in.
Yes,
But
I agree. Yes, ma'am. Yes.
it was interesting how consistently we all scored. We really didn't have great outliers from the scores. And, you didn't find that out till the end and when you were done with it all. But I think that speaks volumes for, the way that we are scoring these. In the credibility. I think it was good. It made me realize that everybody took the right amount of time and the right amount of thought and really put a lot into this. So, but I'm glad that they've made improvements. I can tell you that because I was one having to flip back and forth and all over
Yeah.
the place.
Yeah.
That was
Yeah.
as time consuming as reading.
Yeah.
So.
Absolutely.
Yeah,
Okay.
great. Okay. Well, thank you, Jason, for that. And then the final discussion item is the new board member training packet information. So Jason, again, I call on you for.
Sure. So we went to the ACMI business meetings in Chicago earlier in December and met some wonderful other, not only executive directors and staff of mental health boards, but also some mental health board members there. Certainly would encourage at maybe some point in the future for some of our board members to attend one of those business meetings. I think they do them in the spring, summer, and then also winter. Maybe they do them quarterly, but I'll share that information as it comes up. But we had the wonderful opportunity of meeting some members of the Madison County Mental Health Board along with their executive director, and they had 2 board members there. And they shared with us how they had just put together a board manual, which was like a training manual for new board members coming on board, which of course seemed very timely for us with having some new board member appointments. So we asked them to share that with us, and I'm now sharing it with you. And it is kind of a long packet, so we didn't want to take the liberty of spending time to start putting this together unless the board thought it would be a valuable resource that we would kind of figure out a way to, I guess, model after this, but do it in a way that would be more specific for the Winnebago County Mental Health Board in terms of, some things would be common, like the reference to the Community Mental Health Act, but then of course, a lot of the other documents below that could be unique to the Mental Health Board.
And it is 86 pages. I can attest to that. I did review it, and I think it's a wonderful model. I'm very impressed, and I know we'll customize it to, be very precise and include our documents and so forth. But I have no hesitation about this at all. Why reinvent the wheel when this is such a good example of what we really want to be able to have. And what an asset, what a tool it is for new oncoming board members. And it'll live a lot longer than any of us in terms of, you know, helping kind of keep us grounded. And I like, we always talk about drift, and we've worked so hard at our fidelity in terms of, you know, the community support model and all the things that we have in you know, our mission and our vision and so forth. And I just think that this will allow future board members to really realize the importance of our values. So
Well, and Mary Ann, I think a document, like whether you call it a training manual or a whatever you want to call it, it's important when you're recruiting, I think, to let people know this is a working board. It's so easy to say yes to, oh yeah, sure, I'll be on a board. And then you just mail it in. You know, you show up for the board meetings and you don't exactly know what they're talking about, but you know, they don't necessarily want you to know what they're talking about. Here, there's a real commitment in terms of time and effort, and people need to understand that before they say yes.
I concur.
I was just going to agree with that, and looking at this document, I think you're right that there's a lot we can take from it and just customize. So it's very worthwhile to do.
Yeah, it's a great framework for sure.
Mhm.
Okay, there is not a,
But I would really like to just comment on one part of it though.
yes,
And that is, when I read their mission statement, we worked hard at being very precise about our mission statement and introducing the community support program as our organizing principle. And I guess when I see that, and what I saw is very similar to numbers of 708 boards in our area, and that is their mission statement sets up no boundaries. It gives them, it doesn't focus necessarily on serious mentally ill and or addicted. And so when you see who they're funding and how they're going about it, they're into mission drift. And
well, that's the point, Dick. We would not be using any of
so
that.
I wish them luck, but I'm happy we have done what we have done in Winnebago County.
Right.
I think we.
But if you put it in a document such as this, it lives for a very long time.
Yeah. Okay, anyway.
I agree with you 100%. Okay, so we don't have an action item for that, Jason.
No, it was more to get feedback. And then what we would do is we'd compile that and of course get legal counsel's a review of that on some of the more official things like Open Meetings Act and stuff like that. And then present it back to the board as an actual action item for approval at a future meeting when it's prepared.
Very good. Thank you. And thanks for sharing that. Okay, moving on to other matters. I have no other matters at this point. So the final agenda item that'll get Linda to her next meeting on time.
For adjournment.
Is adjournment, Dick. I need a motion.
I have so moved.
I second.
Okay, no discussion. I'll take roll call. Or do I need to do that? Can I just do a general?
All in favor.
We're all in favor. Say aye. Aye.
Aye.
Aye.
Okay. All right,
Tim.
everyone. We'll
Hey, Tim
see you in
Neighbors.
February.
Tim Neighbors, I'm wearing this sweatshirt for you today. Worsham County. Huh? What do you think, huh? School? The
It looks good on you.
Literary science? Come on! I thought of you to put it on.
I couldn't see it till you stood up.
I
And
know. Well,
it looks good on you.
I wore it for you today, Tim.
I gotta go get
Well,
me
that's
one.
good. Well, Terry's going to be sporting a mental health board one. For
That's
all
right.
of us.
I'm gonna
Yeah.
get one. And I'm gonna wear it next time I go.
All right.
Bye-bye.
Bye-bye.